So let's start with another topic of Müllerian duct anomalies. Okay, so this is one of the important MCQ question that they can ask in your AIPGT or NEET-PG examination. So let's start. So basically what the Müllerian duct will do, it help in the formation of the female genital organs. So the question they can ask, what are the organs that can formed by the Müllerian duct? So this is very important. They form the fallopian tube, uterus, cervix, and the upper two-thirds of the vagina. So remember this. This is a very important anatomical questions they can ask. So very important. So I'm just getting it star marks. Okay. So any error in the formation, fusion, or canalization lead to the Müllerian duct anomalies. Okay. So if there is an like a difficulty in the formation or the fusions of the Müllerian cavity, then it results in this type of anomalies. So what are the most common anomalies you will find? We know that it helps in the formation of fallopian tube, uterus, cervix. So if there is any anomalies, there will be defect in this organs. Okay, so we know that the normal uterus, it has a single cavity, it has an pear shaped. So there are the some type of the uterus which is usually due to the Müllerian anomalies. Okay, so Müllerian duct anomalies. So what are this? One is your unicornuate. So in the unicornuate, what you will see, one duct fails to develop single horn. So there is only single horns, and the other duct, suppose if it is in all this, there are all the two ducts. Here is one duct is absent. So this is called unicornuate uterus. These are all the congenital anomaly. Okay. Now the second one, what do you mean by the didelophyte uterus? If you see the picture, there is a complete fusion failure, two separate uterus and two separate cervixes. Okay, so this is very important. Okay, two uterus, two cervix, and also the even the vagina with the separated vagina. Now this is the diagram of a bicornuate uterus. So there you will find the two horns. Okay, so partial fusion of failure. Okay, and then you will find the two horns and the one cervix. So you should remember the diagram also. Sometimes they can ask you the questions, and then they will give you the image based question. Okay, so you should remember this. What do you mean by the biconnuate uterus? What do you mean by the uterine deliphies? Okay, so these are very important. The fourth one is your MRKH syndrome, that is Mayer Rokitansky Custer Huster syndrome. So what is this? Here the uterus is either absent, uterus, ovaries. Okay, so if you see this one, it help in the formation of the uterus, cervix, and upper two-thirds of the vagina and the fallopian tube. So in MRKH syndrome, there is an absence of the uterus, tubes, and the vagina, but the ovaries are present. Okay, so this is very important. Mayer Rokitansky Custer Huster syndrome. In this syndrome, there is an absence or underdeveloped uterus, upper two-thirds of the vagina or the uterine tube, but the ovaries are present. Okay, and in arcuate uterus, there you will find a mild indentation and at the fundus with normal variant. All these things that MRKH syndromes, I will take another class only to describe this syndrome. Okay, this will be in another chapter. Okay, arcuate uterus, that is mild indentation at the fundus, often the normal variant. Septate uterus, failure resorption, fibrous septum divides cavity. Okay, so remember this. If the question asks you the most common Müllerian duct anomalies is septate uterus, and it is in the this is the most uterus common where there is a miscarriage occur. Okay, so most common anomaly is your septate uterus, and most associated with miscarriage is also septate uterus. So these are both are very important. Okay, now a clinical based question. Now, suppose a woman of 26 years old, she present in your clinic, you're sitting in your clinic, and she will come to you with the recurrent second trimester miscarriage. Okay, she has a regular menstrual cycle and with no history of amenorrhea. On pelvic examination, what you will see that ultrasound shows a heart-shaped uterine cavity. Okay, with two endometrial horns. Okay, remember this, two endometrial horn and a single cervix. So what is whether it is septate, uterine didelophytes, uterus bicornuate and unicornuate uterus. So the answer will be a bicornuate uterus. If you go in the last slide, that is in partial fusion failure. So there is a 2 horn and the 1 cervix. So in the question, what is this? There is a 2 endometrial horn converging a single cervix. So the answer will be uterus bicornuous. Okay. So this type of question they can ask you in your examination. Okay. So these are the explanation. Okay. Now there is another like clinical based question. A 22-year-old woman present with primary amenorrhea. Remember, she is presenting with the primary amenorrhea. Okay. On examination, she has a normal secondary sexual characteristics. Ultrasound shows absence of uterus, upper 2/3 of the vagina. So, but ovaries are normal. Okay, so what is the answer? Is it Turner syndrome, Müllerian agenesis, androgen insensitivity syndrome, and the septate uterus? So, if it is there, that is absence of uterus and the upper 2/3 of the vagina, always septate uterus. What is the septate uterus? That is failure of resorption. There is a uterine cavity is there. Okay. Even the cervix is also there. So, the septate uterus is not the answer. Okay. Now, in the Turner syndrome, we know that ovaries are streaked. Okay. In the Turner syndrome, we know that ovaries are streaked. The ovaries are not normal. Here in the question, the ovaries are normal. So the option in between Müllerian agenesis and androgen insensitivity syndrome. So in Müllerian agenesis, we know that there is an absence of the uterus because, or there is an underdeveloped uterus, or the vagina, or upper 2/3 of the vagina or the fallopian tubes, and ovaries are normal. So answer will be your Müllerian agenesis. In androgen insensitivity syndrome, what happened? The person is your genetically male, that is 46XY, but he is a partially or completely insensitiveness to that of the androgen receptors. Okay, so due to the defect in the androgen receptor, so he is not like insensitive to that of the androgen hormones due to the insensitivity of the androgen receptors. So this will be another important questions about the Müllerian agenesis in a about the androgen insensitivity syndrome. I will take another video, and also about the MRKH syndrome. Okay, how will you identify it when we go for the congenital anomalies of the female genital tract? Okay, so these are all about your Müllerian agenesis. If you have any questions, you can just comment in the chat box.